So I'm here with Lucas and we're going to myth bust. We're going to talk about some common myths that we hear around self-harm and suicide and give you our responses as to what we think is really going on here. So Lucas, you're going to share with us the first myth.
Hi Emily, first up is people who self-harm are just attention seeking.
So attention seeking is a phrase that's become associated with negative connotations, like the individuals being manipulative or dishonest about the intention or purpose of their behaviour. And that narrative is really stigmatising. It's hurtful and it can stop young people from disclosing how they really feel and the behaviour that they're engaging in. Self-harm can be a method for individuals to express and communicate and cope with complex and overwhelming emotions and thoughts, which they may struggle to do verbally. And self-harm is a way of eliciting care from other people, and if somebody is engaging in self-harm behaviour in order for others to notice, pay attention or to get care, then that should be accepted and responded to without judgment or blame and with, care and compassion.
Myth number 2, self-harm is contagious. They are just doing it because their friends do it.
So it's unlikely that the sole reason somebody engages in self-harm is that their friend is engaging in self-harm. A young person that is having all their needs met in a healthy, adaptive way wouldn't engage in self-harm purely due to kind of real or perceived peer pressure, social status, or for social inclusion. Having said that, adolescents have important developmental needs, such as wanting to belong, feeling connected, and being part of a group or community. And meeting those needs are important for their growth, development, and to thrive during adolescence. And that does make adolescents more susceptible to social influence. And sharing problems and experiences can sort of forge that sense of being understood and connectedness. And that in turn can have an exacerbation effect on sort of poor mental health or emotional coping and sort of associated behaviour such as self-harm. So it's really important to remember that self-harm is functional and it serves a purpose. And in those that appear to engage in self-harm where perhaps social factors are significant, it's identifying what the individual and collective needs are of those people who are engaging in self-harm so that perhaps more adaptive and less harmful ways of meeting those needs can be explored.
Myth number 3, people shouldn't show their self-harm injuries and scars.
So it's really important that no one feels judged or blamed for engaging in self-harm behaviour. The first priority is absolutely ensuring that the young person has their self-harm injuries appropriately treated and dressed if needed to prevent infection or further harm from occurring. And many young people, they won't want to actively display their self-harm injuries or scars, but neither should they be made to feel as though they've done anything wrong or that they should be ashamed of having injuries and scars. So to manage this, young people together with their parents and carers or other adult care providers, so maybe school staff, can perhaps discuss how best to manage this in a way that the young person doesn't feel stigmatised or compromised, but it also takes into account perhaps other young people's needs, such as within the school environment. It is important to remember and understand that, visible signs of self-harm can be distressing or triggering for other young people. Of course, there may be times when self-harm is visible, so perhaps it's a hot day and the young person chooses to wear a short-sleeved top. And in those instances, perhaps the young person, together with their parent or carer or support from another adult, wants to think about what they might say if they're approached by others about their self-injury scars.
Myth number 4, people who self-harm are suicidal.
So it's not necessarily true that people who self-harm are suicidal. People can engage in self-harm without any thoughts or urges, plans or intent to end their life. Some people who engage in self-harm may experience thoughts and urges to end their life, but the self-harm behaviour is not an attempt to end their life. And some young people may engage in self-harm behaviour which could be life-threatening, even if they're not intending to end their life. Research does suggest, though, that about half of those who end their life by suicide have previously engaged in self-harm behaviour. Many of the contributing and risk factors for somebody engaging in self-harm or ending their life by suicide are similar, so it's really important to explore with somebody their intent and their function of the self-harm to establish whether or not they're also experiencing thoughts or urges to end their life.
Myth number 5. The severity of the self-harm reflects the severity or intensity of a person's difficulty or distress.
So the nature and the degree of self-harm is not reflective of an individual's difficulties or distress. What is important, though, is to try to understand the function and the purpose of the self-harm in order to sort of best support and help an individual. It's really important to take the person seriously, regardless of how severe their injuries are or appear to be. You should never assume that a person's difficulties or distress are not serious or not having a significant impact because their injuries are not.
Myth number 6. Asking someone if they are thinking of suicide or using the word suicide puts the idea in their head and makes them more likely to do it.
This is not true. Asking somebody if they're thinking of suicide or using the word suicide does not put the idea in their head or encourage them or make them more likely to do it. People can find it really hard to initiate talking about how they feel and find being asked direct questions much easier to respond to. Being clear and asking directly about suicidal thoughts, urges, plans, or intent can kind of allow you to really understand or to discuss what's happening and make a plan of action together. Asking somebody directly about suicide and using the word suicide ensures clarity and no room for misinterpretation or error. It also avoids judgment, as statements such as doing something silly can really invalidate how somebody is feeling and add to their sense of worthlessness and being a burden or not being taken seriously.
Myth number 7. People talking about feeling suicidal are not intending to take their own life.
Okay, so this isn't necessarily true. Experiencing suicidal thoughts and urges is a unique experience. Some will feel unable to share or talk about how they're feeling, whereas other people might feel more able to do this. But regardless of whether somebody is able to verbally or directly express and communicate those thoughts and feelings of suicide, or they try to communicate non-verbally or indirectly that they're struggling in this way, everybody deserves respect, care, support, and to be taken seriously.
Thanks, Emily.
Thanks, Lucas, for going through those myths with me. Let's hope that people have found that a useful learning experience. So for more information around crisis, self-harm and suicide, please do visit the Hampshire CAMHS website, which is www.hampshirecams.nhs.uk.